Hi, I'm so sorry for that video cutting off, but I did want to finish or give you guys the opportunity. Again, my name is Kalia. I am a doctoral candidate for healthcare administration, and I did want to give you guys the opportunity to put your comments in regarding your reason why, whether it's healthcare, business, education, what made you choose that particular profession. I want to share with you the reason why I decided to go back to pursue a Doctor of Health Administration is mainly because of experience. I want others, whether you're a patient, provider, to experience what it's like to have integrity, to have compassion, to have empathy, to show up wholeheartedly for your patients, to have someone that you can work with, that you can co-labor with in the healthcare sector that actually gets it. I want to say I may not know everything, but I know what it is to be a patient in need of care. And I know the importance of having someone come into my room and be there for me. And I know what it feels like to have someone come into my room and not care. Either way, this experience has led me to a decision to always treat, whether it's my co-workers, whether it's the physician that I'm working with, whether it's the patients, to treat them with care, to treat them with a sense of presence, to allow them to receive and know that I actually care. I care about my patients that I'm caring for. I care about the physicians that I'm working with, the nursing staff, whoever it is that I am coming in contact with. I want you to walk away with the experience that Kalia cares. She's truly in it for the right reasons. And I have the ability, and I thank God for it, to be able to discern going into a healthcare facility and actually see the mismanagement of, I want to say staff, but the mismanagement of each other. When I asked myself many years ago, why did I choose healthcare? I've always wanted to be a doctor ever since I was a young girl. We had healthcare family members that were close to me. I just always had a desire to help. I've always felt sensitive when someone got hurt. I'm crying with them. I always wanted others to be better. So with this, I asked myself now, as I'm going into the second half of my life, I'm not going to tell you my age, but I had to really dig in and ask myself, hey, why continue to pursue healthcare? And again, my passion is I want to see people helped. I want them to be healed. I want them to be whole. I want them to experience someone that actually loves and cares for them. And you know what happened? My husband ended up with a cold, and he's coughing and he's hacking, and I could find myself like putting my hand over my nose. I'm like, oh my God, you go downstairs with that coughing. And conviction hit me. It hit me so hard as to, you say you want to help people, right? And I'm like, okay, it starts in your home. It starts with the people you love. And so it made me take inventory of myself. A lot of the times we can be in a routine of doing something or providing care to people because it's a job to do, to where now we're home, that job doesn't stop. It should have started at home. And so I had to apologize to my husband and say, I am sorry. You do have a cold, and let me make sure that you're okay, because I can't give someone an experience that I don't wholeheartedly commit myself to in and outside of the job. So this goes back to having integrity and actually being honest with ourselves and taking inventory of ourselves, whether we're on the job or off the job. If I care for patients, my patients start at home with my children, my husband, my family. Am I really there for them? Do I show up? And my answer is yes. I took care of my grandmother. I took care of my grandfather. I'm taking care of my kids. I'm taking care of my husband. I care. I actually really do care. So when I go into the healthcare facility, I am making sure that my doctors are okay. Every doctor that I've worked with, I'm trying to make sure that I'm committed to learning their way, how they prefer to work, so that I am not in the way of them providing care. So please share in the comments, why did you choose your area of expertise? Thank you.